Welcome to what you need to know to keep your child safe. First, we need to give disclaimers. We're not providing medical advice, and we're not telling you how to raise your child. Our purpose in this short video is to show the importance of educating your child about HIV and AIDS. We will provide background information about what HIV and AIDS are, dispel myths surrounding HIV and AIDS, and discuss methods of prevention, general testing, and a public organization that can provide further help and information. We will provide all of this in simple terms and avoid medical jargon. As a parent, you will thus be better equipped to ensure the safety and welfare of your child.
It is no longer an option to talk to your children about HIV and AIDS. It is an imperative. 3 in 5 teenagers have had sexual intercourse by age 18, and others are engaging in sexual activity at increasingly younger ages. Many counties in Kentucky don't teach about HIV and AIDS in public school, and with HIV and AIDS rates on the rise, education has never been more important. It is up to you as parents to know the facts and teach your children the truth about HIV and AIDS.
I'm here with Dr. Frank Romanelli, a faculty member and Associate Dean of the College of Pharmacy, and he's going to help explain to us a little bit more about HIV/AIDS. Thanks for being with us, Dr. Romanelli. So could you explain a little bit about what is HIV and what is AIDS?
Well, sort of globally, HIV is a virus. It's the human immune deficiency virus. And a person can be HIV infected and not necessarily have AIDS, but they can have AIDS without having HIV. So HIV is the virus that's in the bloodstream after an infection occurs. Once that virus does enough damage to the immune system and the patient meets certain criteria, they'll get a diagnosis of AIDS, HIV/AIDS. And once a patient has AIDS, they sort of can never go back to not having AIDS. And the term AIDS just indicates that the disease is sort of progressed a little further than simply having an HIV infection.
Right. And how is HIV virus transmitted?
In the United States, the primary mode of transmission is through sexual contact, particularly MSM, men having sex with men, followed by high-risk heterosexual contact. The second most common mode of transmission is high-risk sexual contact. And then the third most common mode of transmission is injection drug use, so sharing drug needles where one of the users is HIV positive, the needle becomes contaminated, and then it's shared with someone, and the infection can be spread.
Right. But not typically, or not able to be spread by hugging, kissing, shaking hands, things like that?
HIV is a very difficult virus to transmit. You sort of have to have had either significant blood exposure or sexual exposure. It's not transmitted via saliva, from using plates, forks, knives, public swimming pools, mosquitoes. There just isn't enough of the virus in those fluids to allow for transmission. It's really a blood-to-blood or sexual fluid contact disease.
So are people able to tell right away when they're infected? Are there signs and symptoms to look for?
Typically they can't. One thing that does happen after infection, usually within a couple of days of infection, is the patients will develop some flu-like symptoms, and they may misdiagnose themselves as having, either a mild case of the flu or just a virus, but they may feel a little bit run down, a little bit of fatigue, fever, aches and pains, a little bit of a rash. But that usually goes away after a couple of days, and then the patient will typically go into a symptom-free interval where they really have no symptoms until the virus reemerges.
So during that symptom-free interval, the person is still able to transmit disease, correct? Since they still have
At any time after infection, a patient is contagious. Whether they have symptoms or whether they don't have symptoms, whether they're on medication, whether they're not on medications, once they're infected, they're able to transmit the virus to someone else if they're not practicing safer sex.
Okay, so can you tell us a little bit about the treatment available for HIV/AIDS?
So we do have some options to treat HIV. Once a patient is infected and they reach a certain criteria in their disease, we can start medications. Typically we use 3 of our medications at one time. So it is a number of meds that the patient has to take. And the meds have side effects and they can affect the patient's quality of life. But they do prolong survival. So patients on medications will live longer. The medications sort of convert the disease into more of a chronic disease. And if patients take their medications, they take them on time, they use all 3 meds, typically they'll die of other causes. So, in a lot of instances, we begin to think of HIV a lot like diabetes. If you take care of yourself, see your provider, and take your medications, you'll probably die of something else. So that's what the medications have allowed.
The safest way to protect your child from HIV and AIDS is for them to practice abstinence. But as we stated before, some will engage in sexual activity. The next best method of protection is condom use. Whether it's oral, anal, or vaginal, a condom should be used every time. Remember, HIV and AIDS can be contracted with one unprotected sexual encounter. Buying and providing condoms is the role of the males, but more recently, they have come up with lame excuses not to wear them. These excuses range from them being too tight or uncomfortable in bed. To avoid these excuses, it is important that females start owning, providing, and carrying condoms. Next is Dr. Richard Crosby, who is the Chair of Health Behavior at the University of Kentucky College of Public Health. He will demonstrate the 7-step model of how to wear a condom and the ease and convenience of HIV and AIDS testing.
All right, how to use a condom. Step 1, check the expiration date. Make sure the condom is fresh. Step 2, at one corner, doesn't matter which one, tear open gently the package, only the corner of the package. Take the condom out. One finger is all you need. Step 3, the most important, find out which way is up. In this case, if that points up, the condom unrolls perfectly, so this is correct. Step 4, if this were the penis, we're going to put the condom on, so the receptacle tip hangs off the end of the penis. We're going to gently unroll that condom, one smooth motion all the way to the base. During that process, if you need to, use the other hand to squeeze the receptacle tip so air doesn't fill that space. At this point, you can see the condom is on correctly. There's no air in the receptacle tip, and there's no air bubbles down the shaft. Step 5. During sex, be sure that lubricant is added to the condom so it doesn't dry out. Step 6. When ejaculation has occurred and sex has ended, hold on to the rim, this is the bottom part, with one hand while withdrawing the penis from the mouth, anus, or vagina of the sex partner. And finally, step 7, remove the condom from the penis away from the genitals of the sex partner so there's no leakage, and dispose of the condom, again, so there's no leaking possible onto the sex partner's genitalia. That's it. 7 easy steps to successful condom use. So HIV testing used to be a complicated process. It used to require drawing blood, waiting for 2 to 4 weeks for that blood sample to be analyzed, and getting people to come back so they could hear the results. Today, fortunately, because of breakthroughs in technology, none of that needs to happen. We can now test for antibodies to HIV through a sample from the oral cavity. This sample, this oral mucosa specimen, can be used to test for antibodies, and the rapid test that can be applied to that specimen will allow us to know within 20 minutes whether the person will be HIV negative or diagnosed as a preliminary HIV positive.
You've heard the facts, you know the statistics, so now it's time to act and keep your child safe from AIDS, HIV. While we can't cure AIDS or HIV, we can help talk to our children to keep them safe from the infection.
And the best part about it is the solution is free. A 5-minute conversation could save your child's life.
While your children may not always admit that they're listening to you, studies have shown that over half of the children get their information about sex from their parents.
But in schools, abstinence only is taught. Kids don't have information about safe sex when they first engage in sex. So be the first to talk about them and give them the correct information.
We know talking to your kids about AIDS, HIV isn't easy, But by giving them the right facts and the statistics, you're enabling them to make safe decisions.
You heard the facts, you saw the video. Now all that's left to do is act. You would do anything for your child, so why not try and keep them safe?
The solution is free. Talk to your kids about AIDS, HIV.